Hi, Namaskar. I am Priyanka, a senior nurse from Panaceayur Multi-Speciality Hospital. So there is a very good news for all my viewers who have herpes infection. Today we'll discuss the cure for herpes. So our subject expert Dr. Arjun is here. So doctor, there is really any cure for herpes where the entire world says there is no cure for herpes.
Hare Krishna everyone. I am Dr. Arjun from Panaceayur. Indeed, there is no cure for herpes in allopathy, whereas in Ayurveda and Unani, there is a cure, and we have been curing a lot of patients across the world. Even there are very few doctors available in India who have been curing this infection.
What are the medicine available in open market, Dr. Arjun?
There are two types of medicines available in open market.
Part 1 medicines contains Gandhak Rasayan 2 tablets twice a day or Nimol which contains pure Gandhak 2 tablets thrice in a day. Vadhi Har Rasayan 125 mg twice a day. Hirak Bhasma 5 mg twice a day. Shila Sindur 5 mg twice a day. In case a patient has gastric and acidity, they are advised to take Sudsekar Ras tablet twice a day, Mukta Shukti Bhasma 250 gram mg twice a day, Panskar Churna 3 gram twice a day. Next part, this is another type of medicines which is available. We have mentioned here as a part 2. This dosage is for 30 days and it is not allowed for diabetic patients. First tablet Nimol, 2 tablets thrice in a day after food. Next, they need to prepare certain medicines in their home. They have to buy all the raw materials like turmeric 250 gram, ashwagandha 100 mg, 100 gram, mulethi 100 gram, giloy 50 gram, black pepper 50 gram. I have mentioned here preparation method. They have to stir the turmeric in a pure ghee at a low flame for 10 minutes, make it cold and grind it until it becomes powder. Other items can be made powder and mixed together. They need to store and keep it in a safe place in an airtight container and consume it as per the guidelines. This part 2 contains two other medicines which is Khamira Marvid Khas 5 gram twice a day. Then Jawa will Misk Motadil Jawahar Wali 5 gram twice a day.
Is there any precautions for this medicine, Dr. Arjun?
Yes, there is a precautions for these medicines.
Okay.
So let me explain you. A patient has to avoid oily and spicy food, as well as if they are taking non-veg food outside like meats, fish, anything else apart from veg, they have to avoid it during the course of treatment.
Okay.
And they have to also avoid intake of alcohol and smoking during the treatment.
How much is the efficacy of the medicines, Dr. Arjun?
We have 100% successful results. Let me share you one of my live reports of myself where I can show you how much duration it took to clear the virus from the body.
Okay.
So I'm logging into a website called Tata 1mg Lab, which is a subsidiary brand of Tata Motors. Here I can show you a live report of myself. So we are logged in successfully. My lab test. Let's go to bottom. View more. So before starting the treatment, let me show you the report where you can note it down the date and time. It was conducted first on 7th November 2021. What is the value of IgM? Here you can see it's negative, whereas IgG, HSV1 and HSV2, it says positive 1.86. Now we'll go to another test after the medicines of consuming the medicines of 1 month. What is the value? Here you can see it was conducted on 18th of December 2021 by ELISA method. HSV1 is 48.09, HSV2 89.64. So ideally the viral load in the body got increased. So to ensure whether the reports are correct or not, I again got it checked on a different date with a different method. Again I got it checked on 24th December 2021 by CLIA method. Here you can see, yeah, the value is higher. So it's a 5.85, date on 24th December 2021. Next reports we have on 9th Feb 2022. The test was conducted by CLIA method, and the value here you can see it's negative. When a patient gets outbreak like cold sores on genitals or mouth region, lips region, they are advised to take the blood test for HSV1 and HSV2. In fact, the patients are not aware of other viruses like CMV or rubella or Epstein-Barr. In this scenario, the medicines mentioned above will not work if a patient has CMV, rubella, Epstein-Barr along with HSV1 and HSV2. So in that scenario, this medicine needs to be prepared in a proper facility as per the viral load of the patient and age, duration of the infection, as well as if they have consumed allopathy viral medicines, since how long they have been consuming the medicines. So these all factors we consider to prepare a medicines for curing CMV, rubella, or Epstein-Barr along with HSV1 and HSV2. As discussed earlier, there are 8 types of virus in herpes family. The people who wanted to know about herpes family, they can refer a website called NCBI. It belongs to United States of America. There is a book which is written by Samuel Baron. So it has got a lot of topics. The people who wanted to know more about herpes family virus facts and figure, they can go through that. Plus let's focus on CMV and rubella, how it affects the body of a human being and what are the symptoms of CMV. So as per the website of NHS, which belongs to United Kingdom, here it's mentioned the people who get CMV infection, they may get high temperature, ache in the muscles, tiredness, skin rashes, feeling sick, they may have sore throat and swollen glands. But the people who conceive a baby with this infection and the baby is born with CMV infection, what baby may have complication? They may have a rash, yellow on the skin, whiteness in the eyes, that is jaundice. It may cause jaundice. It may have a premature baby, low birth weight, a smaller head than usual, seizures, hearing problems either in one ear or both ears, problem with the eyes, problem with the liver and spleen. Let's see rubella. What is rubella and how it affects a person? Rubella is a rare disease, and the people get vaccine in their childhood. Even if they are vaccinated,
We have seen certain cases they have infection of rubella. So what happens in rubella if a person has this infection? They may have ache in fingers, wrist or knees, a high temperature, cough, sneezing or runny nose, headaches, a sore throat, sore or red eyes. What happens if a baby is born with this infection? Generally, it causes miscarriage, serious problem baby may have when the baby is born, such as problems with the liver, sight, hearing, heart, or brain.
Thank you, doctor, for sharing all the information. I hope that our viewers will get lots of insights to cure the infection and save life.
Thank you, Hare Krishna. May God bless everyone.